Hello, my name is Adrienne Corkill, and this is my persuasive speech on cost-free healthcare in America. Don't call an ambulance! Something anybody from another country would be appalled to hear. However, millions of Americans fight this life-saving treatment until tooth and nail until they cannot anymore, simply because they cannot afford it. In a day and age where equal rights are advertised across the country, why is it that only the upper class can afford simple medical procedures without financial strain? What America needs is a complete remodeling of the cost of healthcare, where it is guaranteed to any American, regardless of their economic standing. By eliminating the financial burden of healthcare, middle and lower class individuals will be able to seek out medical procedures without financial consequences. According to the Honorable Anna G. Isho, a representative in Congress from the state of California, in a set of proposals to achieve universal healthcare coverage, every American should feel secure that if they get sick or if they are hurt, they will receive the health care they need without going bankrupt. However, the cost of visiting a doctor is out of the picture for most Americans. This causes an avoidance of preventative care and also causes the refusal of treatment until a condition is severe enough that they have no choice. It can also cause an indirect loss of jobs because of absences where they are required a doctor's note, but they're missing work, which means they cannot afford to go to the doctor. According to a study done by Ashley E. Birch, even with health insurance, out-of-pocket costs and high deductible plans create a cost barrier that leaves medical care out of reach for many Americans. This pattern is clear to anyone who has struggled financially. We need to attack this problem at the root. Cost-free healthcare breaks this barrier completely. Not only does this remove anxieties about costs, it also benefits communities as a whole. Community benefits of cost-free healthcare extend far past the less fortunate. However, increasing the wellness of this group particularly increases the wellness of America as a whole. According to Rui Nunes, health is an essential good for the human condition. We must promote it universally so that all human beings can enjoy this right. Indeed, most developed societies recognize the existence of a basic right of access to healthcare of appropriate quality and consider it a positive welfare right. So why should America be any different? A country who advertises itself as the best, the greatest, still puts financial burden on those who simply are sick and need help. According to Allison P. Galvani and other researchers, universal healthcare coverage decoupled from employment and disconnected from profit motivations would have stood the country in better stead against a pandemic. This is referring to the COVID-19 pandemic. This means that had cost-free healthcare existed during the COVID-19 pandemic, Americans would have stayed home and avoided going to work when they were sick because they would not be worried about what would happen if they lost health insurance because they would be unemployed. Had this been the case, this would have slowed the spread of COVID-19 and reduced the effect of it as a whole. These two examples clearly show that the system is flawed. We need a system that will benefit society far past just the individual or the family. So what benefits would be for the smaller communities? Standard procedure associated with the cost-free healthcare cause minorities less difference in treatment than male, white, or rich individuals. According to a study done by Vijay Badale, MBBS, and other researchers, standardized evidence-based protocols and treatment pathways within healthcare systems have the potential to enhance clinical outcomes and minimize the influence of socioeconomic and racial disparities on postoperative mortality. This study was done on hip replacement patients where all procedures were completely standardized. In a cost-free system, all procedures would need to be standardized in order to guarantee that federal money is not going towards problematic procedures. When patients are treated the same, regardless of demographics, there is no evidence of change in mortal risk during procedures. Without these standards, this mortality rate rises because of negligence, racism, and classism. Altogether, why I believe cost-free healthcare in America, no one should have to choose between their health and their financial stability. We must stand for those whose voices are suppressed. We must push for support equally for all Americans rather than just the wealthy. Everyone should be able to afford healthcare. This should not be a question, and I firmly believe that a cost-free healthcare system in America would be the most beneficial to our country. Thank you.